Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Infectious arthritis. Introduction. Infectious arthritis is an inflammation of a joint caused by infection. Bacterial, viral, or fungal infections can spread from another part of the body to a joint, causing infection. Infection and inflammation in a joint can damage the cartilage and synovium. This causes arthritis. Infectious arthritis is also known as septic arthritis. This program explains infectious arthritis, including the different types. It covers symptoms, causes, diagnosis, and treatment. Joints and arthritis. Our bones help us stand up straight, and our muscles help our bones move together. Bones connect at the joints. The most obvious joints are the shoulders, elbows, wrists, hips, knees, and ankles. We have joints between the different bones of our fingers and toes. We also have joints that allow our vertebrae to move. A material called cartilage covers the ends of the bones of a joint. It keeps the bones from rubbing against each other during motion. There is a little bag containing a small amount of fluid, called synovium, between the two pieces of cartilage in a joint. The combination of cartilage and synovium allows for smooth, painless motion. If the synovium in a joint becomes inflamed, it could end up being destroyed as well as the underlying joint. When arthritis is very severe, both bones of the joint may actually grow into each other. This causes the bones to fuse together. Arthritis happens when the cartilage and the synovium in joints are destroyed. Arthritis usually leads to pain and limited movement in the joint. There are many types of arthritis. Osteoarthritis is due to chronic wear and tear. Osteoarthritis is more common in older people. Post-traumatic arthritis is due to trauma to a joint. Trauma may happen during a car accident or an injury, such as a sports injury. Rheumatoid arthritis is an autoimmune disease. The arthritis results from your immune system attacking your body's own tissues. Infectious arthritis is caused by an infection in the body that spreads to a joint. Bacterial, viral, or fungal infections can spread from another part of the body to a joint. This program focuses on this type of arthritis. Infectious arthritis causes. Infectious arthritis is caused by an infection in the body that spreads to a joint. Bacterial, viral, or fungal infections can spread from another part of the body to a joint. Once the infection reaches a joint, the joint cannot protect itself from the invading bacterium, virus, or fungus. The body's reaction to an infection in the joint includes inflammation, increased pressure, and reduced blood flow to the joint. This also adds to the damage of the joint. Sometimes infectious arthritis can affect a joint without directly infecting it. This is called reactive arthritis. Reactive arthritis is inflammation of a joint in reaction to an infection elsewhere in the body. The joint itself does not become infected. Reactive arthritis usually affects the knee, ankle, or toe.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Symptoms. Infectious arthritis usually causes severe pain in the affected joint. A person may also find it difficult to use the affected joint. Other symptoms of infectious arthritis include chills, fever, swelling of the affected joint, warmth or redness of the affected joint. The joints most commonly affected in adults include joints in the arms, joints in the legs, especially the knees. Rarely, infectious arthritis may also affect other joints, including joints in the back, joints in the head and neck. Diagnosis. Infectious arthritis is diagnosed with a complete medical history and a physical examination. A joint fluid analysis may be done to discover which bacterium, virus, or fungus is causing your infectious arthritis. A sample of fluid from the joint is taken using a needle. Lab tests can use the sample to find out what is causing the infection. Blood tests can also help in diagnosing infectious arthritis. For example, a blood test can tell your healthcare provider if there are bacteria in your bloodstream. Urine samples may also be tested. Imaging tests can show if the affected joint is damaged. Examples of imaging tests include X-rays, MRIs, and CT scans. Treatment. Treatment for infectious arthritis depends on the cause. A joint infected with bacteria must be treated with antibiotics to prevent joint damage. You may need to be hospitalized to receive the antibiotics intravenously or into a vein. The infected joint can also be drained of fluid to prevent damage. Viral infections do not respond to antibiotics. Most viral infections in the joint go away on their own and do not cause joint damage. However, for certain viral infections, such as HIV, antiviral medicines are available. Aspirin and ibuprofen may also be taken to reduce swelling and pain. Fungal infections of the joint may be treated with antifungal drugs. The joint may also need to be drained. Reactive arthritis may be treated with other medicines. Medicines may be used to suppress the immune system or reduce inflammation. Rarely, surgery may be needed to treat infectious arthritis. Surgery can remove infected tissue. Sometimes surgery may also be done to reconstruct a damaged joint. Often, the affected joint is rested or placed in a splint when first being treated. However, exercising the joint is recommended soon after. This can help restore the joint's strength.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Infectious arthritis is an inflammation of a joint caused by infection. The infection comes from a bacterial, viral, or fungal infection that spreads from another part of the body. Infection and inflammation of a joint can damage the cartilage and synovium. This causes the pain and joint deformity associated with arthritis. It can also cause symptoms of an infection, such as chills and a fever. Treatment for infectious arthritis depends on the cause. Treatment may include antibiotics or other medicines, joint drainage, and surgery. The amount of damage to the joint depends on the type of infection. Bacterial and fungal arthritis are more likely to damage the joint than viral arthritis. However, early treatment can prevent serious damage in most cases.
Thank you for using Explain.